don't think I've met you before. I know your byline, but.
Cheryl, do we
Yeah.
have Sam?
Good to meet
Usually
you.
in court, so.
Okay. Good to see you,
Hi,
yeah.
Dave. Hey, Dave. Meet you.
So, folks online, you can hear us?
Yeah, Maddie.
No
said-
sound?
Yeah. Oh,
Yes,
They
Maddie
okay.
can
said
hear
they-
us, you
okay.
can't hear us, okay.
Okay, we are not going to repeat roll call. Just know that there are people in the room and there are people online.
Yes.
Okay, is there any public comment on items not on today's agenda? I will share one bit of news. The press release just came out from U.S. Department of Transportation that the Rail Authority and the Western Transportation Institute out of MSU were successful in a federal $6.5 million federal grant to do workforce training
Awesome.
across the country. So we are subrecipient for that. So
Congratulations.
for what it's worth. Okay, no other public comment on items not on the agenda, so we will move on to the consent agenda. We have 4 items. Any questions, Juanita, on this?
No.
Is there anyone,
Oh, yeah, sorry. Does anyone
anyone want to speak
to
to anything on the consent agenda? Okay, seeing none, we'll move forward.
Okay, I move to approve the consent agenda.
We'll second that. Further discussion or public comment? Seeing none, all in favor?
Aye.
Excellent. And it looks like, I'm assuming, Jeremy, you're going to present. I don't see Jeremiah in the room here, so.
Oh, he's gone.
So we have a Homeland Security Program grant.
Correct. So this is to get a signature for the State Homeland Security Program grant for a Rook Armored Critical Incident Vehicle. This is a one-time expenditure. It's not an ongoing one like our EOD grants or anything like that. So what this is for is an armored vehicle that's much smaller in size. It's basically, for lack of a better term, a skid steer that's armored up. So it allows us to deploy resources to second windows or second story or third stories in some instances. Allows us to get much closer to potential suspects who are barricaded and be able to communicate better with them. We can deploy gas much easier from it. It has a bunch of different features that I can get to, and if you'd like. The overall tactical plan, I think, for the state is to place one in the western region, which is going to be Missoula, and then I believe Billings is attempting to get one for next year to handle the eastern half of the region. So that allows it to be utilized as a regional tactical asset. So.
And what is the price tag?
So the overall price for everything is, they awarded 500,000. That's for the vehicle, the trailer, the accessories, quite a few accessories that come with it. You know, that gives it the ability to, like I said, deploy gas remotely, has observation platforms, has an actual lift platform that's armored, so you can put people on it to put them on different floors. And obviously just it's tracked, so we can drive through people's yards if necessary without doing undue damage to their property, their septic tanks or anything like that, where some of our other armored vehicles you couldn't do that with. So the 500,000 is.
Seems really reasonable, like 500, or maybe, I don't know a lot about armored vehicles, but like, that's not terrible.
Yeah.
I mean, it is very expensive, but I'm
$500,000
thinking of like plow trucks and, I mean, tractors and whatnot, like,
To move it from point A to point B, so.
okay.
This be available for particularly rancorous community council meetings?
And this is, I'm sorry, this is shared regionally or how much?
So it's based out of the sheriff's office here, but Missoula County as a whole usually acts as regional asset. I mean, we assist with Mineral County, Ravalli County. We have members with Ravalli County on our tactical team. We work very closely with CalSpill's tactical team in assisting like Lake County. So it really does get utilized in regional capacity, just like our team does.
Okay. And Missoula County will own it, or who?
So how it works on any of these grant programs is technically the federal government owns it for a period of time. I want to say 10 years, don't quote me on that. And then after that, it becomes the sole property of the counties. We are responsible for any maintenance items, maintaining it, and doing anything. They just award the grant to make the material available.
Got it. Okay, thanks.
So is the action here to have
the chair sign a grant application and then we'll find out if we'll
This
get
is the
it?
acceptance.
It's
So
the
we've been
acceptance, okay.
tentatively
Got it.
awarded it. So usually, once a tentative award, there's the final agreement, which is the acceptance of that agreement, at which time the grants typically get awarded in October, and then we can go ahead and put the order in. And that could take, who knows how long to actually get it into play. There's other paperwork that we have to do to make sure we're
Supposed to
meeting
sign, right?
FEMA requirements and
Oh, okay.
everything else.
Okay,
If you're comfortable with it.
any other questions?
No, I move to approve the State Homeland Security Program grant.
Second that. Any further discussion or public comment on this item? Seeing none, all in favor?
Have you guys had a chance to play with one?
They have actually seen one, got to see it in person. I know that Billings is excited and says that if, once it's received, they are actually gonna send their teams up to start training with it potentially early. So they're already kind of ahead of the ball if they get theirs next year, which is what they're hoping for.
Okay, thank you so much. We have no other action items. We have a discussion item to request that the Board of County Commissioners observe a presentation. I've never seen an item like this before, a request to observe a presentation and participate in a conversation. So who is talking about this?
It's me.
Well, what would you like us to observe?
Participate.
Performance.
Yeah,
No, this-
come on up to the table here.
No.
Yeah, all of you can, what you want.
I did bring a little informational sheet that you will be familiar with the layout, Dave, from our board presentations. And
We're supposed to act it out.
yeah, this is a quick impromptu comedy session. I wanted to bring this grant to this meeting because it was in the spring when I talked to Josh and Chris about it. This is a grant that is awarded to Missoula County through the Substance Use and Mental Health Services Administration and was applied for kind of through the work that we do with the Strategic Alliance. But the health department was the one who ultimately hit the button back when Damien was still here. And PHC is kind of the one who will hold one of the project director positions, at least for the first little bit of this grant, and open to exploring like where else this work could live. So just to highlight, so I mentioned that it's the Substance Use and Mental Health Services Administration, and it's the Children's Mental Health Initiative. And this is an opportunity to better coordinate the youth systems of behavioral health care, similar to how we are starting to coordinate our mental health or our adult systems of healthcare.
And that coordination program is called what for the adults?
We call kind of it the Strategic Alliance. I mean, it happens like, that's kind of the governing body that coordinates a lot of it. And then, but that's where the improvement kind of lives with a variety of different agencies. And so we'll replicate something similar with the youth systems of care. But just to highlight, this is $1 million a year for 4 years. And there is a match component. It's 3-to-1 in the first 3 years, and then 1-to-1 in year 4. And we can primarily meet that through positions we already employ, as well as a 10% indirect cost rate for each of our partners. The grant really responds to kind of a growing need that is identified. We see it, you hear a lot about it in the press, just for youth behavioral health crises, as well as kind of what we have seen in the youth SIM, identified this as an area of need. And after the youth SIM that was conducted in the fall, which stands for Sequential Intercept Mapping, and Chelsea or Chantel could talk more about that process. But from that, there were areas identified and then kind of adopted into the work plan for the Strategic Alliance for Improved Behavioral Health. And I say that because this SAMHSA grant has both a direct service component as well as kind of a governance infrastructure component, and having kind of a governance board that, and I use the word governing, but like a coordinating body is maybe a better way to say it, is one, I think one of the reasons we were more competitive with the grant award. And so there's really we have these 5 really high level goals that I put on this sheet for you all.
So just so I'm clear,
Yeah.
is this the presentation we are observing right now?
I am,
I thought I was waiting for the request that at some date there would be a presentation that we were invited to participate in.
oh, yeah, if you want to be invited, I can. make that
Very
opportunity
trendy.
for you.
Okay, they are observing and participating, okay.
Becca asked if there should be a PowerPoint. I said no, but interpretive dance would probably.
Okay. I was,
Yeah.
okay, I'm back on track.
And so, so I think kind of the first goal is to improve the coordination across kind of these siloed systems. Chantel, you kind of talked about them yesterday. We've got behavioral health, we have juvenile justice, youth courts, schools.
The Venn diagram that I was the way that services that overlap in individuals' lives are siloed systematically.
Yeah.
So for folks who are unhoused or struggling with housing, there's one system. For folks who are justice involved, there's another system. For folks who have behavioral health, substance use disorder, there's another system. And then youth delinquency prevention, so stopping any of these cycles, it has its own silo.
But if you're interacting with all 4 of those,
Yeah.
your care or your treatment program, like those components can't talk to each other?
Not well.
Not well, got it. But now with this new organizing, governing, what was the word you used? Coordinating. Now, like, all those 4 different entities will know what Jimmy needs or wants or.
That's the dream, but this one is really focused on that youth delinquency prevention and youth needs, but also the youth system.
Okay.
And we do have a lot of work to do to like integrate these silos together.
Yeah, it won't happen quickly. It will probably take a few years. And then,
What's the organization, the group of service providers that deal with, maybe is it a homelessness? I thought there was where they do interact with law enforcement, with the POV.
Are you thinking
with-
about CIT,
Maybe it's a CIT, okay.
which is a program
Okay,
within the police department that also helps look at crisis response to adults with behavioral health issues.
okay, but my understanding was like once a month or that all the entities get together and then they can like share information on,
Those are the crisis first responders.
okay.
and I think how this is different is that at that point, when you rise to the point and you're being discussed in a group like that, like you're really a very high user.
Yeah.
And so
okay, maybe
this is
a
more
confused thing.
across, I think, so that everyone kind of has an equal opportunity, like,
To engage.
not that high users would definitely be part of that, but creating systems where that happens more often for everyone, if that
Okay.
makes sense.
Sorry to interrupt. Go ahead, sorry.
No, that's
Goal
great.
2.
Those are great
Okay.
questions. Please engage.
And it's
Just observe.
And then there's kind of this ER encounters and inpatient admission components. St. Patrick's is a partner. Some of these are very lofty goals. Reduce the length of stay in an inpatient setting by improving our community-based transition services. Again, kind of a partnership with youth homes and St. Patrick's Hospital. And then we want to ultimately decrease the number of youth who are at risk or have a social emotional disturbance, who are engaged with the juvenile justice system by creating more appropriate responses and having
taking
not
them-
only the juvenile justice response, I guess is what I would say. And then the final goal is kind of to increase family and youth engagement in influencing the kind of systems level change. So kind of like a peer advisory committee. Among other things.
Among other things.
Yeah. There are Missoula County will employ the project director as well as the lead family coordinator and a family peer support specialist. We are in conversations with Aware Mental Health Center about how they want to be involved in this project and will likely result in a change to this exact list of partners. Providence will be involved and will employ a few different positions to expand on work they are already doing, as well as to improve their transition team for kids who are transitioning out of inpatient stays or what's the word? In the juvenile justice system when you are jail. Yeah. And then youth homes as well will be involved, and they will employ a couple people and have a bed in their crisis shelter for youth.
How many youths are
That's a really
serving? What's this? Yeah.
scope
Yeah.
of that's a great question. And I wish I had written that down. So in the first year, I think the number is pretty small, like 75 kids. And so the first year started on 9.
And these are kids, I mean, some of them are housed and have
Oh, yeah.
family.
Yeah. Yeah. Some of them are housed and have family. Many of them may have complicated family circumstances.
Is there any such thing as an uncomplicated family
Right.
circumstance?
Yeah. And then in the following years, I believe it's about 200 youth a year. Yeah.
And this is countywide or just?
Missoula countywide.
Okay.
Yeah, countywide. Although it will need to think about ways to engage some of our more Sealy Lake, because I know the school up there often would like more support. And so not something we've talked about yet, but horizon.
But on that one, we have a real opportunity with the rural domestic violence grant that we just got, which also
Oh,
is going to be looking at how to engage with the school in primary prevention of youth-based teen dating violence, that sort of thing. So having multiple reasons to talk to the school and other community providers together helps strengthen these things.
great. I mean, we were here, when's the last time that we were speaking with schools or the superintendent and it was frustration or just exhaustion of how difficult it is managing kids in the classroom. And it's gotten really bad since pandemic. All ages, not just, little guys all the way through high school.
This is true. Yeah, and I think PHC has some providers who are in the school, as does Aware, and starting to coordinate those services a little better and how that pathways will flow to these types of services, I think are hopefully what we can start to improve.
So how can we be helpful?
I think what I was hoping,
Get
is
out of the
just make
way.
sure you were aware. Because I felt, like it is a Missoula County, it's awarded to Missoula County. And PHC is working will take on some of these roles. And I just saying that we're open to where else this should live. If it's the health department, really.
Where do you want to
wherever.
live?
I don't know yet.
Help this.
Let us know.
There's going to be more to come. Multiple
Yeah.
positions, multiple projects. So we wanted you guys to have some awareness. So you're like, SAMHSA, what is this
Yeah.
grant?
Whenever I see Samsung, I'm like, it's enormous and federal. People are just doing all the things. So
Yeah.
that's
Good summary.
Well, we're who you can reach out to if you have any questions about those things.
awesome.
And I'm not 100% clear on if the process, so we presented today and if it needs to come back to you all?
Yes.
Okay, and so we can.
What needs-
And he said it's approved to accept the grant.
Oh, not approved to accept the grant.
We can't take action.
Doesn't go
Setting.
Yes. It was awarded and then we're doing the final grant amendment and then we'll have a clean NOAA a notice of award that I can bring back for you all
Oh,
for
then
review.
they will sign that.
Okay.
Okay.
I just want to make sure I have the money piece clear. It looks like it's about 1.3 million a year for the next 4 years.
Yeah, so it's 98777.
Did you get one of
for
these?
year one.
I did, yes, and I'm doing some math, but that's not my strong suit.
Yeah. So there's about $1 million in federal dollars, so that 99877, and then the non-federal match is non-federal dollars.
That's the match, is that?
That's the
second
number.
number? Okay.
Yeah, and so
Okay.
every year we'll figure out essentially how we're gonna do the match, and similar to the crisis diversion grant has a match component too.
But you just said this, but like, how many years? Oh, three,
Four.
four.
And is the federal amount the same for each year
It increases slightly each year, but not much. The max award is $1 million.
per year?
Yeah.
Okay, thank you for clarifying that.
And it is an opportunity that you can apply for again. So if you're making progress in year 4, you can apply again and maybe get it. So that's always nice.
So can you paint like a ideal kind of like dream situation or a goal or what we expect to see, how this impacts someone's life, like this time next year? Like what do we want to be able to say about this?
I think that's such a good question, and the visioning that we haven't quite got to yet. I think what I would hope is that, you know, you're seeing families and kids when they have a first interaction with, let's say you take your child to the ER for a mental health crisis, and instead of being kind of just released, and I don't actually know exactly how it works
So is
now,
that,
but yeah,
someone has to be like that freaked out about their kid that they're going straight to the ER versus it's like, so this is bad. But,
Yeah.
Okay.
and I use that example, but I don't want it to only be kids who are in crisis. Like, I think there should be multiple pathways for connecting with services that your family needs. And I don't have a good sense of what those look like yet.
But I'm sorry, I interrupted you. Sorry. So family takes kid to the ER, then.
Sure, and then you are released back into the community with kind of a wraparound plan for supporting the family and the kid.
Okay.
And like a
Would you
plan to
say?
go back to school.
Yeah.
Yeah.
Right, like reintegrating into the classroom, also a component that ties in the whole family into that conversation. And those are pieces that are sort of scattered right now.
So whoever the kids saw or the family saw in ER, I mean, there's a whole team that they'll probably see there, right? And then they will work with the school, all the kids' teachers. I mean, how does the plan get implemented or carried out? Okay, but that's the goal, is like everyone who touches this kid's life will
Yep.
be on somewhat the same page to help
Right.
them.
And I think some of it's impacted by the changes in the school, like the care that's available in the school system. And part of that is like, what exists anymore with the
okay.
cuts? And like, how do we shore that up and get these people talking to each other and community-based providers? So a lot of it, just with the youth stuff, is necessarily the school system and the hospital systems and private therapists.
What's an example of a community-based provider in that scenario? Like a community-based provider is what? Is who?
So like connecting hospital clinic person to the care team within the schools is what I'm talking
Okay.
about. So having that kind of like those minutia pieces that put those case managers in touch with each other.
Okay.
And we talked about CIT earlier. They're actually moving to a platform that includes youth and family engagement as well, which wasn't part of their previous model when they did their case mapping with the frequent utilizers. So I think coming off of the spring sequential intercept map meeting, there was a lot of talk about like, how do we better serve youth who are justice system involved, hospital system involved? Like, this is prevention, this is deflection, this is diversion. Like, how do we keep these kids from escalating and getting more involved in the first place? So that is what a lot of this has come out of.
And I do think goal 5 is really important to the visioning, because there's, what professionals who are in their offices think, and then there's the experience of families. And that really needs to be built in for this to be effective. So being able to bring those components in before getting way too far down the road on all of the visioning to ensure those voices are included.
So kind of the picture now is if somebody goes into the ER for mental health, they evaluate, they try to do what they can do, but then they release that patient, and then the family has to find
Okay.
all those resources, and it's very, very difficult. So this is awesome. Speaking of experience.
Okay. Yes.
Yes.
Yeah, it can be an overwhelming system.
Yes.
And the behavioral health system, the folks who work there, with money that's come and gone over the years, this agency was healthy 2 years ago. It's not healthy now.
Right.
This agency is healthy, but the user doesn't know that. And these services were available 6 months ago, but now they're on hiatus. And all of that makes it so difficult for the individual in our community because they're not experts in it and they're navigating a system that's like built on Jello right now.
Well, fortunately, Medicaid's really easy.
Yes. and assured. In perpetuity.
Horrible. It's so broken.
So this grant will fix
Yeah.
tiny.
A piece.
Well, thanks for presenting to us. I will sign whatever needs to be signed when it comes my way and we approve that, and don't hesitate to come back at any point. Provide an update that we can observe and participate in.
Participation is.
Observation. Yeah, are there other communities that are in the state that are doing this well-ish, or like that? Or are we just forging ahead, tip of the spear?
I would say, hey, it's probably unique to Montana, but I'm not 100% sure about that. This grant, the SAMHSA Children's and Mental Health Initiative, is actually one of SAMHSA's oldest initiatives. And so it's pretty well established across the country and in other communities. I had talked to Damien right before he left, and he had one of these grants when they were in Oakland, California, and said that it was hugely beneficial for their community. Exactly how, I'm not sure, but hopefully we will find the same.
Great.
And I would say Gallatin's doing pretty well. They actually just built a youth care campus for kids like 11 to 18.
Oh, wow.
It's
The county did?
it's their HDRC and some
Oh, really
Boys and
good.
Girls Ranch. They came together. It was like a community coalition. I mean, a whole bunch of partners, and bought something that looks a lot like a barn, but turned it into a care campus for kids, like a one-stop shop. So
Wow.
it's pretty innovative. I want to get down there and see it.
Yeah.
Yeah, we're
I wanna
thinking
go.
about a field trip. Do you want?
Yeah.
Yes.
Want to come?
Yes. Yeah, I would like to, yeah, whenever you guys decide to do that. We like field trips.
Is there a bus we can rent?
We have a big old van.
Great.
Yeah, there's a party bus.
Oh my God.
Yeah.
Yeah, this is great.
Our poles.
Yeah, don't-
Anyone online have any questions or comments?
We're online, sorry. This is great.
I think those
Okay.
people probably have a lot of questions after that.
Yeah, maybe.
Thanks a lot. Appreciate it.